Hello everyone, this video is Anconeus and Extensor Indicis or Extensor Indicis. It can be pronounced either way. So here we go, we're on page 139 in your book. We're going to get right to the screen share. Off we go. All right, so this is Anconeus. Anconeus is a word that means elbow in Greek. So that's basically where it is. This little muscle right here is Anconeus, and it does provide a decent amount of elbow extension in addition to the triceps, right? But it can be difficult to palpate because back on this side of the forearm here, you have all of the extensor muscles. So picking out Anconeus individually can be a little tricky in palpation. Either way though, it originates on the lateral epicondyle of the humerus, right here, you can see, and then crosses the elbow here, and then inserts on the ulna at the olecranon process, which is this bit, you know, and the posterior proximal surface of the ulna. All right, so origin, insertion. So that means that we'll draw, that the force is going to be going this way, right? Because the insertion moves towards the origin. We're just going to remind you of that real quick. Insertion moves towards the origin. So if the muscle shortens, it is going to extend the elbow. Okay, now, Anconeus is just a small little muscle that you actually can palpate it at the lateral epicondyle. Most of the time, it's going to be easier to feel sort of right in here and just a little distal. So if we pick out the olecranon process and we pick out the lateral epicondyle of the humerus, and we extend the forearm like this. Okay, Anconeus is going to be right here. Okay. Anconeus, the little muscle that could. That's really it for Anconeus. We're moving on to Extensor Indicis or Extensor Indicis. Honestly, it doesn't matter. Your book calls it Indicis, but it can be pronounced with a hard C or a soft C. Either one is acceptable. So this little extender is actually located just at the distal part of the forearm. It is a little tiny muscle, and what it does is it extends the index finger, hence the term extensor Indicus, right? So it extends the first finger. All right, so this one's going to be deep to extensor digitorum. Remember, extensor digitorum is this one, all the tendons right here. If you extend your index finger at the metacarpophalangeal joint, you might get two side-by-side tendons passing across the top of the knuckle. Yes, so you can actually see this on my hand, and I will show you in a minute. I'm going to have to stop the screen share here so that you can see it on the big screen. But let's talk about the origin and the insertion. Origin is the posterior surface of the distal shaft of the ulna, because we're way down here, and the interosseous membrane. So right here is the interosseous membrane. Remember, that's the soft tissue attachment between the radius and the ulna. The insertion, of course, is going to be on the index finger. So we have the tendon of the extensor digitorum at the level of the second metacarpal. So here's something interesting. We have an insertion on a tendon. So this insertion doesn't pull directly on the bone itself. It pulls on another tendon, which then pulls on the bone. So extensor indicis has to work with extensor digitorum in order to move the index finger. But since it is a separate muscle belly, it can do things that extensor digitorum can't. It can extend the index finger, which is the second finger. Remember, the thumb is the first. It can adduct the second finger. Okay, so this is what this looks like. So here's extension, right? And then adduction. See how I made it go that way? Extension, adduction. Okay. If we're bringing all of our fingers together like this, that's adduction. So if I'm just doing it with one, and you can do it with your index finger, you can go that direction. Okay. It may assist to extend the wrist because it crosses the wrist joint, right? You can see that right here, crosses the wrist joint. And if it crosses the joint, it affects the joint. Although it's not a strong extender of the wrist, it wouldn't be. It's so small. Okay. So extensor indices, let's stop the share for a second. All right, so if I extend my fingers like this, you can see these tendons here are extensor digitorum, right? Okay, I'm just gonna curl, right? You can see it right away. Just gonna curl my fingers down. See how these tendons separate? Actually, I'll do this, you can see it. See how the tendons separate there, right? Okay, and the other fingers, there's just one. See, no matter what I do, there's still just one. But as soon as I curl my fingers down and my index finger is extended, you can immediately see this tendon right here, right? It move. Oh, isn't that creepy? Whoa. See, they separate right there. This is extensor digitorum. This is extensor indices. Extensor digitorum, extensor indices. Oh, I know. Silly human tricks. Okay, so you know what extensor indices does? It allows you to point to things. Okay, everybody, that's it for Anconeus and extensor indices. Stay tuned for more exciting anatomy.